One of the biggest concerns for near retirees is the high cost of health insurance in retirement. Hi, I'm Michelle Smollenberger, a fee-only financial advisor here at FDS. And today we're going to talk about that high cost of health insurance for near retirees, and that's as they approach retirement. So here's a few things we're going to touch on today. First, just concerns. This is something that we see people who come in nearing retirement. There's a lot of things that they're thinking about and they're concerned about this area. Then planning ahead for these costs, and then finally just some things you want to consider as you're planning ahead for retirement. So when we think about the concerns that people have, typically it's because they hear that health insurance coverage for retirees, as you're approaching it, for retirees, is that it is expensive. And let me just give you an example of what it could cost. So for one person, for example, in retirement, if you're just paying for health insurance, it could cost, and sometimes we assume, $1,000 per person. So this is some assumptions that we will make. So for example, if you're just before retirement and you've got a few years and you need to assume what healthcare is going to look like, sometimes we will assume around $1,000 per person, or sometimes it could be $500 a person. It really depends what coverage you're going to get and what your income levels are. So these are just some basic assumptions where if you're concerned, and as we're trying to plan ahead, these are some numbers that we can use. So other things that and reasons that people are concerned are because healthcare, so Medicare costs, for example, likely won't get cheaper. So this probably will only continue to get higher. I do want to point you to a blog post that we wrote on this topic, and we actually give a lot of historical charts in here that show the cost of healthcare and the inflation of those costs historically over the past. And so you can actually see what that looks like compared to just normal inflation. So for things like grocery, gas, all of these things we use every other day besides healthcare, you can actually see the different costs of inflation for those compared to each other. So you might find that really interesting as you're planning ahead for this. And then finally, we aren't getting younger, and so as we get older, our health insurance is just that much more important, and the services that we're going to use are likely only going to increase. So there are reasons to be concerned. And so what we're trying to do is to say, let's plan ahead for this. So let's just think about this planning ahead piece. And I want to just kind of show you this on a timeline. And this is just from when we're younger, and we're going to think about this when maybe you start your career. So maybe around age 30 you can start saving. So at this stage you're really saving for. So if these are things that you're concerned about even now and how you're going to fund this as you start doing some financial planning, there are some things you can be doing when you're young. You can be saving. So things like HSAs, this is a great tool. Now as we get closer to retirement age, so let's think ages 50 or 55 or 60, this is where you have not quite reached age 65. And so you need to figure out how you're going to cover your health insurance before Medicare kicks in, because we know at age 65, Medicare is a primary source of health insurance, and we've got a video on this, so you can go look at that as well. But here in these ages here, when you're really starting to think about retirement, this is where you may have several different options. So you may have employer-provided retiree coverage. You may need to get just coverage from the health insurance exchange. And so this is really where you don't have anything provided to you from your employer. And so you need to just buy a policy for yourself based on the needs that you have. And so very similar to with your employer, you're actually shopping between policies to say, this is the coverage I want. Do I want prescription coverage? Do I just need basic medical coverage to cover things like physical each year? That's really what you're shopping between. And so depending on which policy you choose, that's going to affect the cost that it is, as well as the income that you have. Those are the factors that will affect this health insurance exchange policy. So these are a couple of ways. And then if you were someone who funded an HSA from early, this is actually something that now could be really beneficial to you, because you could start using those funds to plan ahead in these near retiree age years. Once Medicare comes, Medicare is going to be the main coverage for this, but again, you could also have this employer provided retiree coverage. There could be something there on top of this, or it could be a Medigap policy. Now, these are the things to think ahead as you're planning ahead. This is a lot of your options that your strategy is going to come from. And so you're going to see, what do I have first? Then what can I use or what's available? And then what do I need to go buy if none of these things are available through an employer or any other way, maybe through a spouse and their employer. This is how you want to think about it. So finally, one of the things that you really need to consider, and this is something that you really have to watch out for, especially in retirement, and I would say all through retirement. So once you're thinking about retirement, age 65, let's just use that age, 2 years before then, what you really want to be watching out for are your income levels. One of the biggest pieces, and we've already talked a little bit about this, is that in retirement for health insurance, this Medicare, these premiums are based on income levels. And also, we already talked about this, the healthcare insurance exchange, these are also based on income levels. Now, when we were in these examples, we were saying for one person or for two people. Now, if we were to double these coverages, so if we're talking about $2,000 a person, now this could be per month. So this is a monthly expense. So this is why near retirees have concerns about this, because these are high costs that they have to cover. Now, if we're talking about these amounts, what you're wanting to make sure of is it's very easy to get over income levels that can push these amounts even higher because you're in higher income levels. So let's assume you're a single person. That income tax bracket, or that range of income you can earn before your premiums move higher, can happen really quickly. This is why between the income levels and the number of people and what you have available all affects each other. So this is exactly why this planning is important. These are the things that you want to consider as you're thinking ahead about health insurance in retirement. If you've realized that maybe this is something you need help figuring out, we have a podcast, we have blogs that you can watch and learn more, but most importantly, if you know that you specifically need help for your plan, reach out, schedule a time to get started, and we'd be happy to set you on a timeline so you know you can be confident for your plan ahead. Thanks for watching, and we'll see you next time.